Good morning, everyone, or maybe good afternoon, depending on where you're joining us from. My name's Rachel Browner. I am the program coordinator for our OneOp. It's my pleasure to welcome you to today's session on navigating TRICARE's Autism Care Demonstration, a guide for providers and military families. In case you're joining us for the first time, I'd like to give you a brief tour of our webinar platform so you can find your way around. Hopefully you're currently able to view the slides we're sharing. If you're unable to see them or have any other difficulties, please email us at contact@oneop.org for tech support. As some of you have already done, we look forward to having you join us in that chat pod for conversations and questions. To embed that chat pod so you don't miss any links or conversations, simply place your cursor over the shared slides. You'll see a toolbar pop up across the bottom of your screen, and from there, just click that chat bubble icon. So when typing questions or comments, please be sure to select the Everyone from the response options drop-down menu so everyone's able to view them in the chat. And please note the slides and resources are available for download on the event page for today's session, and we're going to be covering continuing education information at the end of the webinar. So stay tuned at the end if you're interested in continuing education credits or a certificate of attendance. And as I mentioned, several of you have already posted in the chat. Let us know where you're joining us from. It makes this platform a little bit more personable, helps us to get to know you. There's a lot of fellow Texans on here. I'm located here in College Station, Texas. See Texas, Georgia, Oklahoma, West Virginia, Tennessee, Virginia, even those that are up early on the West Coast from California. Thank you for joining us and being on with us so early this morning. All right, finally, closed captioning is available for this webinar. You can turn on the subtitles via that Zoom toolbar if you need it. Again, thank you for joining us as we continue our partnership with Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. I'd like to introduce our presenter for today, and we're really excited to have Dr. Biena be our presenter. Dr. Biena is a clinical psychologist and a senior policy analyst for the Defense Health Agency in the Medical Affairs Directorate of Falls Church, Virginia. She serves as the Defense Health Agency lead for the complex pediatric clinical community and is the clinical program lead supporting TRICARE health plans for the rapidly evolving autism care demonstration, where she implements clinical expertise in programs development and oversight for a program that significantly impacts overall military readiness. Dr. Biena has over 20 years of experience working directly with beneficiaries diagnosed with autism spectrum disorder, as well as their families and other healthcare providers. So without further ado, I'd like to go ahead and turn over the presenter reins to Dr. Biena at this time.
Hi, did I successfully unmute myself?
Hi, you sound great, Dr. Biena.
Awesome. Hi, everyone. Today I am going to be talking, I'm so sorry. I am going to be talking about the ACD. My apologies, my father just decided to call. I'm going to be talking about the ACD, but I'm targeting the conversation towards you all as providers who interface with beneficiaries, whether you're I see a lot of folks EFMP, I see maybe some support personnel, some other folks, maybe the clinical and or non-clinical side. So I'm really going to target my presentation today on things that might come up in conversation for you and hope to arm you with useful information, resources at the end, and how to best support families. So if I go to my next slide, we'll talk about the ACD, the background, the genesis. We'll talk about some of the key things that you may encounter with beneficiaries. And like I said, I'll close out with some resources for you and for families. And then hopefully I have saved sufficient time for questions. Okay, so before we go on, I want to say that I probably will hit on a lot of things that may spark some questions, or maybe you'll think of specific beneficiaries. I'd ask that beneficiary specific questions be directed toward the managed care support contractors, but if they are program or policy or process type questions, I can certainly answer those here. Anything else that maybe falls outside of the ACD, depending on what it is, I may be able to answer, but likely I'll defer to either a follow-up email or question, or work through the team here, the OneOp team here, to get you an answer. Okay, so the background. So TRICARE covers, and on my next slide, I'll show you what those are. TRICARE, the basic medical program, covers a full range of medically necessary services for the diagnosis of autism, and I'll show you a sample next slide. But I'm going to focus today on the autism care demonstration, which provides those clinically necessary and appropriate ABA services, or applied behavior analysis services, for the core symptoms of autism. And for those who either aren't familiar, or if I could help quick recall, those core deficits are related to social communication and repetitive or rigid behaviors. Those are the two areas that we are targeting when it comes to the clinical coverage of ABA. And why that's important is ABA principles can be applied to a variety of people in a variety of contexts, right? Across the lifespan. So not all of those interventions, or those principles are I'm air quoting, but medical, or would be considered like a treatment or an intervention. So I'm going to give you a couple examples to maybe put it into context of how behavior modification is occurring every day, all day, to all of us. So a couple of examples that I think folks can relate to are speeding tickets. Speeding tickets are a behavior modification strategy, and I would argue that they're generally ineffective because people generally don't stop speeding. So you have to be caught all the time. But those tickets are a behavior intervention or a behavior management strategy to reduce your speeding behavior. I'll give another example that I think a lot of folks might have familiar, or at least can visualize, is slot machines at casinos. Those are great behavior modification activities, especially when someone is winning, right? It's called an intermittent schedule of reinforcement, and the winning, or the noise, or the lights, or the excitement, those can be reinforcing to certain players. And so it's a great strategy, a behavior strategy for casinos, not always a good strategy for the player. But those are some real life examples about how behavior management is happening all day around us. I think the last example that comes to mind is our paychecks. We get paid every 2 weeks, or whatever your employment schedule is, and that's a reinforcement strategy to show up to work to do your job. Again, real life examples of behavior management, but I chose those in particular because you can tell those are not what I would call clinical behavior management strategies, but they do clearly shape behavior. All right, so moving on, I mentioned that there are a lot of services that are covered for the diagnosis. And on the left-hand side, you can see what's covered under the basic or the medical benefit. I've listed here the ones that are generally used by beneficiaries diagnosed with autism. So occupational therapy, physical therapy, speech and language are probably the most common other services that are used, but you'll also see kids or beneficiaries who may have medication management. There oftentimes autism has a comorbid condition, so there may be other health services that are offered. Again, medication management is a common one. You might see behavioral health services. And then the other one that I like to point out is case management. I'm going to be talking about that later. But case management, there's a component of it covered under the basic benefit. There are a whole host of other services like nutrition services, genetic testing. Those are other services that are available under the basic benefit. Not everybody uses those, but I wanted to mention them. And then on the right-hand side is the autism care demonstration, and that is the authority to cover those clinically necessary ABA services. The two models there actually reflect like the provider makeup and how the treatment plan is executed. I'll talk about that later. The other one I want to mention here is the Autism Services Navigator. I talk more detail, but I want to put the plug in that this is the ACD's dedicated care management person. Um, Again, I will talk more, but that's unique to the ACD, and we rolled that out back in October of 2021. So as beneficiaries come into the program, they automatically get assigned these autism services navigators, and they follow the family until they withdraw from the program. Okay, so let me go to my next slide. Let's talk about eligibility. I think that's one that you guys might hear often. What are the eligibility requirements for the ACD? So first and foremost, you have to be a TRICARE eligible beneficiary in an eligible plan. That look maybe TRICARE Prime, Select, that TRICARE Prime Remote, TRICARE Young Adult. It could be any one of those eligible plans. They must have a definitive diagnosis of autism. And I emphasize the word definitive because there's discussion about the concept of a provisional diagnosis, and TRICARE generally doesn't cover provisional or not confirmed diagnoses. So this would be from your diagnosing provider, the approved ASD diagnosing provider. At that first appointment, there should be in order to get ABA, there's the diagnostic checklist, which is what are the symptoms presented, what do they look like, and then there's a use of a validated assessment tool. That's a one-time requirement. It should be happening at diagnosis. If it's not happening at diagnosis, then when the beneficiary is requesting the ACD, they will then need to complete that measure. And those measures are, again, to aid the diagnosing provider in their diagnostic accuracy. Again, I mentioned a lot of kids or beneficiaries tend to have comorbid conditions, and sometimes they could be, developmental delay. Maybe there's a speech and language delay. There are diagnostic differences, and so that these tools assist the diagnosing provider with that autism diagnosis. The other piece for active duty families is that they must be enrolled in EFMP and they must be registered in ECHO. EFMP, I am sure all of you know, is a service program, so not a healthcare driven program. And then ECHO is an additional benefit for the active duty folks who can access services like TRICARE covered respite, durable equipment, incontinence supplies. So there are a lot of additional services that are available under the ECHO benefit. The last bullet I have there was really important, and again for you all, is to know that when beneficiaries don't have any one of these pieces complete or need help, the contractors do have non-clinical outreach coordinators who can assist the families in meeting these requirements. So let's say they saw a pediatrician who was not comfortable filling out a validated assessment tool. The contractor will help the family find somebody who can do that. Same thing with the checklist. That's a common one that I hear is that sometimes it's the primary care provider who doesn't know how to fill out or is uncomfortable filling out the DSM-5 checklist. Again, the contractor will help identify a provider who can do that. Moving on, I'm going to talk about outcome measures a couple of times, but I wanted to introduce, because this is part of eligibility, is that once the referral comes in, or once we know a beneficiary is out there who wants ABA services, there are a handful of outcome measures to complete prior to treatment. So there's a little bit of time between when the referral pops up and then when treatment is authorized. But there are 3 measures, one of which is completed by the ABA provider, and that's going to be done when that assessment authorization happens. But the other 2 may be completed by the diagnosing provider, the Vineland and the social responsiveness scale. There is a third or a fourth measure, but it's not an outcome measure. It's the parent stress measure, and that is identified at baseline and then periodically throughout treatment to really help the family proactively identify support programs, or maybe resources, or maybe goals are identified on various treatment plans, again, whether it's with the ABA provider or maybe the other provider, treating provider. I think the most common thing I hear about the outcome or the various measures is how do you get them done, or if one provider isn't doing them all. Again, the managed care support contractor will assist the families in finding a provider who is available to complete those. We expanded the provider types who could do these measures in 2021 so that we could address some of this timeliness piece that we were hearing prior to that time. There are repeat measures for subsequent treatment plans. I'll talk about those again, but know that for follow-on care, these periodic measures will be administered. Okay, so this is my favorite part of what we did in 2021 is really providing families with this autism services coordination. So once the family is enrolled in the program, they are assigned that autism services navigator. I want to point out that right now it's only available with HealthNet and Humana. The TRICARE Overseas U.S. Family Health Plans and TRICARE for Life are not required, but as I mentioned on one of the earlier slides, they are able to access case management services. That's under the basic program, so it's not a dedicated or assigned person, but it is somebody knowledgeable about that concept of care coordination, about case management, about assisting the family. Moving on. So let's talk about
Brianna,
that.
we did have a
Oh,
question.
yes.
One of the questions that came in was, what is the process or support to help a retired member or adult who might have been diagnosed later in life as autistic?
There is no difference under the TRICARE benefit for accessing services. I think if they want ABA under the ACD, it is no different. You know, the eligibility, the measures, the support available, an appropriate treatment plan would have to be developed, and I'll talk about that later. But they should have access to the exact same services pending all those things are met, right? Definitive diagnosis, the documentation piece, and then what is clinically necessary and appropriate. I hope that if you need more, we can certainly please put it in the chat and we can talk about that. Okay, so the Autism Services Navigator. So this is an individual, or these individuals are employed by the managed care support contractor or subcontracted out, but they are the responsibility of Humana or HealthNet. And they are the number one person that the family should go to regarding all of that beneficiary's care. So that primary point of contact, the person who will be knowledgeable about autism, pediatrics, the TRICARE benefit, really somebody who is widely knowledgeable and targeted towards this individual and their family's needs. They'll oversee the planning and facilitation. They'll help the family make those appointments, and not make the appointments for them, but help them facilitate, find providers. The third to last bullet there about collaboration, I think, is really key, because this person affords the opportunity for families to have a communication between their providers with the family included. So I think this facilitated role is really important. I'll talk about the comprehensive care plan on the next slide, so I'll hold off there. But then the last one that I really want to focus on here is the ASN facilitates that continuity of care piece. So when a family receives their orders, or they're transitioning out of the military, or maybe they're needing some help, the ASN is going to be the one to facilitate transfer of documents. They're going to transfer the referrals. They're going to transfer the authorizations. They're really that sole source, that point of contact for the family to help facilitate that transition, to minimize the gap. Now, there will always be a gap in services when one PCSs, but we're really working hard to minimize the number of days or the disruption when feasible. I see another question. Should I answer that now?
Yeah, the question is the extended care option only available for active duty, or would a reservist on TRS be eligible to receive ABA for a dependent?
So I read those as two possibly separate questions. I believe that the reservist has to be activated to be eligible for ECHO, but otherwise, if they are a TRICARE eligible beneficiary, they would be able to receive ABA. But I'd have to check on how TRS applies to ECHO. That's a program I don't know as well as the ACD, so I can certainly check on that. I see another. Mhm.
Yeah, can referrals go from East Coast to West Coast, or do the families need to get new referrals?
So under the ACD specifically, the referrals will transfer so long as it's active, right? So the ACD referrals have a 2-year window. As long as it's within that 2 years, they will move with the family. Perfect. Okay. If I move on, so let's talk about that comprehensive care plan. I want to start by saying this is separate and distinct from the treatment plan, and that's really important because I think there's some confusion about who does what and the various roles. So the ASN creates this document that is a conglomeration of all the things, the important things that the family might need. Timelines for when outcome measures are coming up. PCS, they're tracking PCS timelines if when families are getting ready to leave. They're tracking all the services that are available, referrals that may be part of that care plan or that suite of services that a family might access. And families might not want to execute all of those referrals at the same time, but this is a place in one document where the family will have all of that information. The contractors execute a little bit differently, so I don't know specifically, what does the Humaniform look like or what does the HealthNet document look like, but that they're generally collecting these critical components. Comprehensive is the first C in that care plan. This document is to be completed within the first 90 days of that ASN assignment, and then it is updated periodically every 6 months as long as care, again, is ongoing. The other thing I want to point out is that while the CCP may have goals, they're not therapeutic goals. They're goals like, I want to accomplish this in the next 6 months, right? Maybe it's, I want to identify, maybe the family wants to identify a support group for their other children, or maybe they want assistance in autism education, right? So there are things that will be non-clinical, but targets that the family is working towards during these 6 months. Okay. I see the question here. I can take it.
Let's read it out loud though, so just
Mhm.
everyone can know what question's being asked. What's going to happen for West Coast families after the turn of the year and the change from HealthNet?
So I can answer this question in generic. I will then defer any subsequent question to the TRICARE Health Plan and the Strategic Communications team at DHA, who is responsible for a lot of this education. So come January 1st, 2025, the new East Region contractor will be TriWest. And both HealthNet and TriWest are preparing communications, but also DHA Strategic Communications is creating information. I don't know maybe if I can multitask, I can find that website. But there will be outreach to providers, notifications to families. What that is going to look like, I don't know yet. It's still too early in that planning process, but there is a new contractor. And I'll take the minute to point out that 6 states are transferring from the east to the west. I don't remember those. Again, I'd multitask. That are moving from the Humana region over to what will be the TRICARE region. So I'm sorry, TriWest region. So those 6 states will have, again, notification as well, what's happening there. I hope that answers that question. Okay, moving on to the initial authorization. This is, again, another piece where families I hear get confused or overwhelmed and don't know what to do. So I want to help you all, arm you all with information about what happens in that beginning stages following that referral. So once there is a referral and it's all good to go, they're enrolled in the ACD, the contractor will issue an assessment authorization to a specific provider. I'm going to talk about active provider placement later, so I won't get distracted here. But that initial assessment authorization is for the direct observation, it's for review of records, it's for treatment plan development, and that all happens. The ABA provider will then submit a treatment plan to the contractor for review, this clinical necessity review. And then once that's approved, that will be a treatment plan authorization will be issued for 6 months. Why I want to point this out is that I think another source of questions that families talk about is that clinical necessity review process. They don't see any of that exchange between the provider and the family, but sometimes the provider submits an incomplete treatment plan or a non-compliant treatment plan. And so there is dialogue back and forth between the contractor and the provider to ensure that they're covered services, that what they're asking for makes sense, right? If I have one treatment goal, but I'm asking for 40 hours, that clinically doesn't make sense. So there may be some exchange between the provider and the contractor, and families don't often know why there's appears to be a delay, but it's again getting the ABA services in line with the coverage benefit. Subsequent treatment plans have to be updated. So again, it's on the ABA provider to submit them timely. That's another conversation point or a talking point if you're either talking with families or providers, to encourage providers to submit them within 30 or 60 days of the expiring authorization. Really, any risk there is in delay would be that late submission. On my side, I hope you all can hear me. I'm not sure if I'm staticky. Okay. So moving on now to the 2-year referral. So I mentioned a few slides ago that there is a 2-year referral process. If a beneficiary is seeking care beyond 2 years, they must go back to their diagnosing or referring provider for an update. So it's an update to that DSM-5 checklist. Really, it's about documenting where are symptoms now, and is ABA the next recommended for ongoing services, or maybe there's an opportunity to add things or shift gears to another intervention altogether. So this 2-year check-in by the referring or the diagnosing provider is a critical milestone for that medical management and oversight. Okay, if I move on, access to care. So I'll probably spend a little bit of time on these next 3 slides, mostly here, talking about access to care, because I know everybody is interested in ensuring timely access to care. So in the ACD, we applied the specialty care standard of 28 days at 2 time points, right at the beginning for that initial assessment, and then for treatment, that follow-on activity, because really, if you do a treatment plan and then can't access services for 6 months or 12 months, that doesn't really do anything for the family. So access to care within 28 days of that verified referral. So again, I want to maybe belabor the point that the clock does not start when the family walks out of the doctor's appointment. It starts when that referral has met those eligibility requirements. Good news is we've done a lot better in reducing the number of days between that I walk out of the doctor's office and I start my ABA services, but we're still work to do. And then again, the treatment plan, once that treatment plan is authorized, we want that care to start right away. I think a lot of families expect or hope that it is with that behavior technician, that tiered model that I showed, made a reference to earlier, but they're not always staff hired or available. So again, another talking point for you is encourage families to start their parent training sessions. There's a requirement that they start within the first 30 days following that approved treatment plan. But I think families are overwhelmed. They don't remember to schedule. That is a great opportunity to start services. Not the family is not the therapist, right, or the behavior technician, but they are an extension of what the principles of behavior analysis can look like in their daily routine. So learning what ABA is, understanding the basic concepts of ABA, those things can happen the minute that a provider is authorized that care. Active provider placement is one of the key features too to really address access. what happens there is once that verified referral is complete, the contractors look for a provider, actually call or contact a provider who can confirm that they can see the patient within the 28 days. Then that referral gets issued to that provider, and that family has then, the window to make that appointment. It's really important. This part is really important because we're working hard on ensuring that there is an available provider. Oftentimes I hear families will call the provider to make that appointment and they're told, oh, well, we can't see you for 6 months. The family should be calling the contractor back immediately because we want to find that person or that family a provider. We don't want them sitting. There are components to that I think a part of the conversation that you might hear from families is that they're waiting, but they may be waiting for specific things. Maybe they're waiting for a specific provider, maybe they're waiting for a specific time of day, or maybe they're waiting for a specific location. Those waive that access to that active provider placement. So if I'm choosing to decline a provider who is available to me, I have effectively waived my access to care requirement. I encourage you all to have those conversations with the families that take the provider that has availability, because this is about early intervention, early access to service. Families can always switch providers, but again, I encourage families not to sit and wait. I want to also point out that that our last reported data, I don't know if you guys are tracking, we used to do these quarterly reports to talk about each state and whether or not they met access to care. The most current data that I have, which was for fiscal year 24 Q2, so that's January through March of this year, 47 states met access to care. I'm sorry, 45 states met access to care, meaning within 28 days. 3 states met access to care within an additional week, and then there were 2 states that met access to care within 3 weeks. So we're pretty good about meeting access to care in most locations. Obviously, there are some locations where there are fewer providers, but I think that preference of the parent choice or directed referrals interferes with access to care. So again, I would encourage you guys to have those conversations of don't wait for services, get started, get those those treatment plan goals and those care needs going right away. All right, next slide is about the family, the parent and family. We added a requirement for parent participation. We want to really empower families with the skills, the translation, the generalization of what's happening in that treatment time. I mean, it's not just for ABA, but if you think about it, therapy only happens only at a discrete time or period, whether it's a couple hours a day, a couple hours a week. But at some point, treatment ends, whether it's at the end of the day, end of the week, or maybe at the episode of care is over. And we are really focused on empowering families to be able to translate those skills. So to support families, we've also have a toolkit. Again, I'll show you the links for those at the end. For families, there's a website, and I think it's at the end, but it is local area resources, and it's not just healthcare, it's all kinds of things. So maybe food insecurity, education, academic services, things like that. So those are resources on that website. And again, I'll put that in the link if I don't have it at the end. And then we want families to be engaged in whatever other resources they need. So maybe it's mental health, or maybe it's access to Military OneSource, but there's a robust opportunity out there for families, and we want them to be connected. We want them to be supported. That's the goal of a parent engagement. The next slide I touched on a little bit ago, but I wanted to bring it up again because I think it's really important, that opportunity for collaboration between the treating providers, and the family can attend these conferences, but these are vehicles for reimbursement for the private sector providers to get paid for the time that they're using this care coordination case management time. MTFs generally, that's a bundled rate, and well, in the military hospital, they don't bill for it separately, but in the private sector, outpatient providers can submit for reimbursement of their time. Another thing that we've heard, that last bullet, is that there is some frustration with what is required to get reimbursed from that time. I just want to be clear that that's not set by TRICARE, that's set by the American Medical Association. So how many people have to be there, who has to be there, those are set externally to us. Okay.
Dr.
Now
Bano, oh, I'm
yes,
sorry.
no,
We did have an individual that's joining us from Germany right now, and so they were asking questions regarding overseas services. Are there stats on overseas services, and are the navigators available overseas for assistance?
yeah, so there are no autism services navigators, but there are case management services available. And regarding statistics, I believe, I don't know by location specifically, but I believe there are around 200 beneficiaries out in the OCONUS with a diagnosis enrolled in the ACD. I think they're predominantly in Germany, England, and Italy. I think we have a couple in maybe Japan, but they're predominantly in the Europe region. I don't have other details, but if you have specific questions, I may be able to, well, I can certainly follow up. But if you can either email me or put them in the chat, I will see what I can do here and later. Excellent. So my last two slides here before I open up for more questions are resources and information. So on the DHA website there, the health.mil, there are a variety of resources. Those resources are generally for ABA providers, the briefing slides and the Q&As, but they do offer answer. We have over 300 questions and answers to a variety of ACD topics that when we rolled this out in 2021. There is a fact sheet also available on the website. We will be updating it, especially come the new contract. The ACD, the DHA email box there, it is not for beneficiary specific questions. So don't send me socials, don't send me dates of birth, don't send me names, but I can certainly ask policy or answer policy or program related questions. If you do happen to send me beneficiary information, I will send it to the contractor for help in facilitating that answer. But we're happy to take any questions. The contractor websites are next. Those are the ones each dedicated to ACD related material. And as I mentioned earlier, the parent toolkits for HealthNet and Humana, those are amazing resources that really help the family understand the program, understand their requirements. They're easy to sort through, well labeled, very easy to navigate. And the next slide is for families. I hope that you all retrieve this and use this give this to your families. Again, I will update for when TriWest takes over, but these are dedicated phone numbers and websites that each of the contractors have specific to the ACD. There is a generic line for both contractors, and both of them have their customer service folks who are educated to, if there are complicated ACD questions, they'll defer over. But these are the dedicated numbers and websites that families can contact for referral or authorization questions, provider questions, if they want to change providers. All of that can be done through these resources. And I believe my last slide is questions. So I'm happy to answer.
Great. Thanks, Dr. Bennett. We're going to give the participants a chance to start posting some of their questions in the chat. I did want to go ahead and just kind of see if you can offer up some things that might be on the horizon for TRICARE Autism Care Demonstration as we think about, August is right around the corner, 2025 will be here soon. Is there things that providers and caregivers should be aware of as we think about 2025 approaching, or things that you can share on the horizon?
Well, anything pre-decisional, I obviously cannot disclose, but I can say that there are no like no pending changes in coordination. So where 25 is going to come around, the T5 contract will start, and families should see no change in their service. Although I say that, with any transition, there is a possibility, although the TRICARE Health Plan team is working really hard to minimize any disruption. But the providers generally, I believe, will transition right over to the new contractor. We're working on ensuring seamless transitions with authorization. So those dates shouldn't change. The timelines of outcomes, none of that should change for the family. The provider obviously will have to, re-sign participation agreements and things like that, as with any contract transition. I think the only other thing that is not, I wouldn't say beneficiary focused for the purpose of conversation, but for your all awareness, the the um, the National Academies of Sciences, Engineering, and Medicine should complete their independent analysis of the ACD next late summer, early fall. That is a congressional mandate on like I said, the title of the NDA section is the independent analysis of DoD's autism care demonstration. If anybody's interested, there were a whole host of webinars, virtual sessions rather, and in-person sessions. They're recorded. They're on the National Academy's website. Again, if they're not about the administration or contractor oversight or anything that I really covered today, it's really about their evaluation of the program. There may be things that come out of that once it's published that we will review and possibly take action on, but that is way down the road, and any change after that would be far, far further down the road. I see a lot of other questions
Okay,
that
yeah,
came
we've
in.
got a few. One of the questions that came in was really focused on childcare programs. So, are there any resources for military affiliated childcare programs and things to do to support children with autism?
Um, I think I think the answer to that is it depends on where you are located. I'm here in the NCR, and I know there are a robust number of organizations that offer non-clinical services. If you mean childcare as in specific, like um,
They're located in Fort Carson, Colorado.
so I'd have to get back to you on that. That is a good, I'm less familiar with things outside of the East Coast, but I think it is region specific. There may be advocacy organizations, there may be the school districts may have, like again, here in this area, one of the school districts in particular offers parent training opportunities, parent programs. Their daycare component has some services that are available. So I do think it is specific to a region, but the managed care support contractor should be able to help you identify those resources. And again, I will try and multitask to find that link that I was talking about. That is the variety of local level resources. Please bear with me while I do that. And then we can move on to the next
And Dr.
question.
Bannon, when you get
Mhm.
that link, we can actually get that posted to the
Perfect.
website event page so that
Mhm.
everyone can have that there as well. So
Perfect.
once you have that, don't worry, we'll get it posted to the event page if it's after today's session. So,
Perfect.
yeah. There was another kind of question comment from an individual. Can we excuse me, can we reassure families that the change to TriWest won't require them to start back at square one?
I can say for the ACD that we have um, put in place those requirements to transfer those referrals, transfer the authorizations, but that is explicit to the current program now. I would say that I suspect that there will be some families who have a disruption. I suspect that there will be, I hope we will minimize what those are and the volume of that. And the transition team is working these 12 months, this all of 2024, to address those concerns, address any of the transition questions. I I want to confidently say that our autism beneficiaries are going to be well supported. But again, I anticipate there will be some hiccup. I just don't know what that will be.
Okay. And going back to some of your resources that you provided, in
Mhm.
order to get parents connected to an autism care coordinator, does individuals direct them to the numbers that were on the previous slide for the autism care
Yes,
coordinator? Okay.
they
Just
can.
wanted to confirm.
Those are the 800 numbers, and those websites are available for families to contact directly to get that support.
Okay. Latoya had the question, what is considered in the access to care standard? For example, a family can get an assessment pretty quickly, but can't actually begin care for some time. Is that provider meeting the standard? Is that considered standard access to care?
Let me look at that question again. What is can get an assessment pretty quickly? So that follow-up treatment plan, that 28 days for the treatment execution, that's actually a metric to uh, um, it's on the steerage model. It is a metric to prioritize providers uh, who have in fact met that. So there are obviously some providers who will not have staff, or maybe families who won't want to engage in parent training at the beginning. But we do have a metric that we are collecting to prioritize providers who are in fact meeting that treatment standard. I hope that answers that question.
Thank you. And Michelle had the question, if the family is needing to get the DSM-5 completed again, and the PCM does not feel comfortable to complete, and they call to get another provider to complete it, but the wait list is 6 months, will they lose their ABA while they wait?
Um, I would say that if there is a author, or if there's a referral coming up, that the benefit allows for 6 months in advance to start working those requirements. So I know you gave 6 months as a an arbitrary date, but I think that again, engage the contractor who can assist that provider with that element. If we're relying on the PCM to make that connection, that may take a lot longer. The contractors are there to facilitate, to find somebody who can assist.
Okay, thank you. Um, Ginger had the question, can you please clarify what is required every 2 years for an individual to continue receiving ABA services? Is it just the DSM-5 checklist that's required, not a full reassessment and re-diagnosis that must be completed every 2 years?
Great question. I get this a lot. So it is from when it comes time for the 2 year referral, the only thing that is required is an updated checklist. I think depending on the provider who's doing the referral, they may insist on another assessment. Um, I would say, from a clinician perspective, I think it's good practice to ensure that what you're authorizing or what you're recommending is in line with medical care. But it's not required for the referring provider to do another assessment. We don't require it. It's not a condition of an ongoing referral. It is just that updated checklist. And really that's to help the family with documentation, right? What have the last 2 years done? How does it look now? What are the goals? What are the targets? Have we progressed? Have we not progressed? What needs to be changed? And really the diagnosing or referring provider, who's generally the MD or the DO, or maybe a nurse practitioner, psychologist, psychiatrist, they're the ones taking the big picture of that look, and they will be able to help with that activity. I know the question was about what's required, but it's only the checklist, and it's for the purpose of that comprehensive look.
All right, thank you. I'm going to go ahead. Feel free to continue popping any questions or comments in the chat. I am going to move on to the continue education portion of our presentation. I know there's a lot of you that are on that are interested in receiving CE credit or a certificate of attendance. Please know this particular webinar is offering several CE opportunities for social workers, case managers, patient advocates, financial counseling and planning educators, as well as financial certifications for CPFCs. We're also offering CE credit from the American Association for Family and Consumer Sciences, as well as personal and family finance educators and certified family life educators. So, mouthful right there. But we are offering several opportunities for CE for those of you that are just interested in receiving a certificate of attendance to provide to your supervisors or for your own documentation. That is available as well. So, please make sure you go to our event page. You'll be able to find this nice purple continuing education button. You'll click on that. However, Coral, my colleague, has posted a direct link as well to the page where you can go ahead and get CE credit. Please make sure, though, you will need to complete the survey. So you'll complete a survey, follow all the instructions. To complete that survey, and then you'll be prompted to identifying which CE opportunity or certificate of attendance you're interested in. If you have any questions or comments, please reach out to us at ce@oneop.org. All right, so I'd like for you all to mark your calendar and plan to join us on August 14th, 2024 at 11 a.m. Eastern Time. We're going to continue our healthcare series and follow up with our TRICARE series today and follow up in August next month on the 14th, focusing on Medicaid's role in military family well-being and economic security. So we're going to explore next month Medicaid's role in contributing to the well-being and economic security of military families. So for some military families, Medicaid provides additional support not otherwise provided under TRICARE, and so other military and community-based services. So participants will learn about Medicaid's role in providing health insurance coverage for eligible individuals and families. They're also going to learn about recent developments in Medicaid policy. That's going to be intended to address underlying threats to economic security, such as housing and food access. And because Medicaid benefits are not always fully understood and utilized, this webinar is really going to focus on approaches to breaking down barriers to program access. So register, join us on August 14th as we continue our conversation on healthcare. This particular next month is going to be focusing on Medicaid. So we've posted that link in the chat. Also, starting in August, please note we are going to be focusing on economic readiness and military family well-being. So over the course of 6 weeks, our OneOp team will deliver a series of professional development opportunities focused on economic security and family well-being, including on-demand courses and 3 webinars. So those of you that are looking for some CE credits and opportunities, make sure to join us starting in August. The series is really going to equip service providers with the skills necessary to support family well-being while navigating that terrain of economic security for service members and their families. That on-demand course is going to provide that foundational primer to economic security and family well-being. And the webinars, those 3 webinars in the series, is really going to frame economic security through the lens of emotional, physical, social, and financial well-being, while exploring programs, discussing any gaps in service, and investigating ways to better link families in need with services. And so that academy will detail the programs available for military families through cooperative extension services that are aimed at increasing economic security. So please note that course and the webinars in the series are free and open access. So I'll post that link in the chat as well to register and mark your calendar. Oh, Coral has already done it for me. Thank you, Coral, for getting that posted as well. All right, so connect with OneOp to explore any upcoming events and articles and resources. Stay tuned. If you have any questions or comments, we're going to stay on for a couple more minutes for you to gather any last minute resources and information. It looks like, I want to make sure there wasn't, looks like a couple of questions came through for Dr. Biena regarding TRICARE. So I do want to go back since we have a couple of minutes left for Dr. Biena while we have you on. So
Sure.
Tracy mentioned or asked the question to follow up on the question about a retired member adult who might have been diagnosed late in life with as an autistic. Would they qualify for ACD if they have TRICARE for life?
They should. That is a TRICARE eligible plan, and so they should um, at face value, right, making sure they meet all the other requirements, yes, they would be eligible for the ACD.
Okay, thank you for touching on that. I appreciate it.
Mm-hmm.
All right, we'll stay on for a couple of minutes for you to gather any last minute resources. Thank you all for joining us. Thank you, Dr. Biana, for your expertise in this area and for the work that you're doing. Really appreciate it. Um, Liz asked the question, how long are the webinars for the economic security series? Okay, so that one is 1 hour. 1 hour for those webinars. No problem, Liz. It looks like an individual asked the question about AFCPE code. So please make sure that you go to the event page. You'll get a code once you complete the survey. And that certificate, that code will be in your certificate for AFCPE. But if you have any questions about CE credits, reach out to us at OneOp, ce@oneop.org.
Rachel, I know folks are hanging up or disconnecting, but I did send you all the links to the Humana and HealthNet resources for families to find local help. So I would encourage everybody to use it, share it. It is an amazing resource that provides a multitude of local services.
Great. Thank you for sending that, Dr. Biana. I will make sure to get that posted to the event page as soon as we get off.
Great.
All right. Thanks, everyone. We're going to go ahead and wrap up for today. Appreciate everyone that's on and our presenter today. Have a great afternoon.